Let's talk about some myths associated with perimenopause and menopause. I'm Dr. Jen, double-boarded OBGYN and integrative medicine, your hormone and metabolic health expert. So myths, there are a lot of myths around menopause and perimenopause. So I'm going to try to just do a couple, but certainly if there's some great ones you want me to debunk, I'm happy to. Just send me a little comment at the bottom of this video and I'm happy to talk about it. If you missed, I actually did a video on hormone replacement therapy about the different options, so a doctor's guide to HRT. So you can check it out right here, which answers a lot about HRT specifically. So the first myth associated with menopause is that hormone replacement therapy can only be started once you enter menopause. So that it's not useful for perimenopause women, which is completely not true. So as we go through a perimenopause transition, which can be 10 years up to menopause, our hormones are roller coaster effect. They're going down and up and down and up on their way down over the 10-year time span. So restoring those hormones, bringing them back up to levels to where you don't experience those symptoms of perimenopause, like hot flashes, night sweats, low libido, mood issues, like lack of motivation, more anxiety, more depression, more edginess, vaginal symptoms like dryness and frequent UTIs and bacterial infections. There's so many symptoms associated with perimenopause and menopause. In fact, I did a video for that as well about the common signs of perimenopause, but also the unusual symptoms of perimenopause. So check those out too. The links will be in the bottom. So you can start hormone replacement therapy in perimenopause and restore those hormones so that you don't experience those symptoms that are bothersome to you. So it is completely false to say the moment you go through menopause, when you've had 12 months without a period, then HRT is valuable. Not true. 2 is related to HRT. So you can actually be on hormone replacement therapy literally until you take your last breath, if you wanted to be, as long as your health remains good. So you don't have any other risk factors for things like heart disease or chronic conditions that like breast cancer, where you cannot take systemic hormone replacement therapy. So you can remain on it. We no longer have this 10-year cutoff that we used to that said you have to be off of it by 10 years out of menopause. So that has changed as well. 3, testosterone. Oh my gosh, if I could shout this from the rooftops. How is testosterone so valuable when we're 25, but then we have 51 and it doesn't matter? That's just crazy to me. Testosterone is incredibly valuable. It's good for your brain, for your heart, for your bones, for your muscle. So many valuable things that testosterone does. And especially that's why when you're 25, you feel awesome. And when you're 55, you don't feel as awesome. So testosterone, if you need it, not every woman needs testosterone, but if you need it, testosterone can be given in perimenopause and menopause. Just because we don't have an FDA-approved testosterone for females does not mean it's not incredibly important. In fact, PCOS is 1 in 8 women. And guess what? There's no FDA-approved drug specifically for PCOS. It doesn't mean PCOS doesn't exist. It means that, honestly, these things happen and you still can treat them even if there's no FDA-approved medication. And there is compounding testosterone. So there are options available for women, but getting good lab work and understanding whether or not someone needs testosterone is also important. So I did do a whole video on testosterone. You can check that out as well. So that's 3 myths that we've debunked related to perimenopause. Number 4 is actually not related to hormone replacement therapy, but there are a lot of options for treatment of symptoms. It does not have to be hormone replacement therapy. In fact, a lot of women, because I am integrative medicine certified and boarded, women will often want to use multiple different tools in my toolbox. I have a lot of tools to help women in perimenopause and menopause. And so they'll often want to use a little bit of the nutrition advice, some of the lifestyle pieces, sometimes herbs, sometimes supplements, sometimes HRT. So there are multiple different options depending on what you feel is the right choice for you. You are your own doctor. So when you make the choice that what's right for you with your own moral values, there are a lot of options besides HRT. So making sure you find a provider who is skilled in taking care of women from a whole body perspective, I think is incredibly important, because there are things you may or may not want to use depending on kind of what your feelings are and also where you are in your stage of perimenopause. Lastly, I would say the other thing to sort of keep in mind is that for perimenopause and menopause, sometimes it's hard for people to understand what you're going through or what maybe a friend is going through in perimenopause and menopause. And so it's really important to make sure that you share this information. So one of the myths, I think, is that, we have to sort of like suck it up, buttercup. We need to like keep these things to ourselves. And honestly, I have found such value in women helping women explaining to other women, this is something I'm going through, or yes, this can be normal, or you can have help. So finding a community that really speaks to you can be incredibly valuable as you change, as these things happen to you when you go through these stages. So I think, the myth of, don't talk about it or this personal, I think that is detrimental to women's health. So providers should be talking about it like I am right now on YouTube, and patients should be talking about it to each other. So I hope that answers a lot of these myths that there are around perimenopause, menopause. If you have additional ones, just throw them in the comments. I read them and I'm happy to make a video about it specifically. And I hope this helps you sort of find the right provider to help you.